Have you ever heard someone say, I have diabetes or I have heart problems? Did you know these two health problems are like best friends, but in a bad way? Type 2, diabetes and heart disease are deeply connected. In fact, having diabetes makes it much more likely that someone will have heart troubles too. But why? What's going on in the body that links these two together? And is there anything we can do about it? Let's find out by breaking it down into simple parts. What is type 2 diabetes, and what does it do to the body? Before we talk about the connection to the heart, we need to understand what type 2 diabetes actually is. What happens with sugar in the body? Every time we eat food, especially things like bread, pasta, fruit, or candy, our body turns it into a type of sugar called glucose. Glucose gives our cells energy, just like gas gives a car power. To get the sugar into our cells, our body uses a special helper called insulin. Insulin is like a key. It opens the doors of our cells so sugar can go in. But in people with type 2 diabetes, something goes wrong. The key doesn't work very well. Their bodies stop responding to insulin the right way. This is called insulin resistance. So sugar can't get into the cells and it stays in the blood. That means high blood sugar levels. Over time, this can damage the body. How does high blood sugar affect the body? When blood sugar is high for a long time, it starts to hurt different parts of the body. It's kind of like leaving soda on your teeth overnight. It can cause damage. High blood sugar can harm blood vessels. Damage nerves, make it harder for the body to heal wounds, hurt your eyes and kidneys. That's why people with diabetes need to be extra careful with their health. Why is type 2 diabetes more common now? Sadly, more kids and adults are getting type 2 diabetes. Why? Because we're eating more sugary foods, moving around less, and gaining more weight. Obesity is a big risk factor. Also, spending lots of time on screens instead of playing outside makes it worse. Scientists say this is becoming a worldwide problem. That's why it's important to learn about it now. How type 2 diabetes hurts the heart. Now, let's talk about the heart. Your heart is a strong muscle that pumps blood all over your body, but diabetes can make the heart's job much harder. High blood sugar damages blood vessels. Your blood travels through tiny tubes called blood vessels. Some are big, some are super small. If you have diabetes, the sugar in your blood can stick to the sides of these vessels and make them stiff and narrow. This is called atherosclerosis. When blood vessels are stiff or clogged, the heart has to work harder to push blood through. That can lead to high blood pressure and heart attacks. Studies show that people with diabetes are twice as likely to get heart disease compared to people without it. Diabetes and high cholesterol go together. Cholesterol is a type of fat in the blood. We need a little of it, but too much is bad, especially the bad kind, called LDL cholesterol. Type 2 diabetes often comes with too much LDL and too little HDL, the good kind. That makes it easier for fat to build up in the arteries, creating blockages. This mix of high blood sugar and bad cholesterol is dangerous for the heart. Inflammation and the silent damage. Inflammation means the body is trying to fight something, like when you get a scrape and it gets red and puffy. But in diabetes, the body can stay slightly inflamed all the time, even if there's no cut or infection. This silent inflammation makes the blood vessels even weaker and more likely to clog up. Over time, the heart gets tired and damaged, even before symptoms show up. That's why diabetes is called a silent killer. People often don't notice what's happening until it's serious. How to protect your heart if you have diabetes. The good news, you can protect your heart, even if you have diabetes. Let's look at how. Eat foods that are good for blood sugar and the heart. Some foods are like superheroes for your body. They help keep blood sugar low and protect the heart at the same time. These include leafy greens like spinach and kale, whole grains like oats and brown rice, fatty fish like salmon, full of heart-healthy omega-3s, nuts and seeds, which help lower bad cholesterol, berries, which fight inflammation. Cutting down on sugary drinks, fried foods, and snacks is also super important. Move your body. Every day, exercise is amazing for both diabetes and the heart. It helps your body use insulin better, lowers blood sugar, and strengthens your heart muscle. You don't need to run marathons. Even playing tag, jumping rope, dancing, or walking the dog helps. Doctors recommend at least 1 hour of movement each day for kids, and adults too. Checkups and medicine matter sometimes. Food and exercise aren't enough. That's okay. Doctors can help by giving medicine that keeps blood sugar and cholesterol at safe levels. Regular checkups help catch problems early before they become serious. If you or someone you know has diabetes, going to the doctor regularly can save their life. Let's go over the most important points again. Type 2. Diabetes means your body can't use insulin properly, causing high blood sugar. High blood sugar hurts blood vessels in the heart, making heart attacks and strokes more likely. You can protect your heart by eating healthy foods, moving your body every day, and seeing your doctor. Even though diabetes and heart disease are serious, you can still live a long, happy life by taking good care of your body. So remember, the choices you make today, what you eat, how you move, and how often you check on your health, can keep your heart and body strong for the future.